All right, and as we've been telling you all morning long, Sid Cicero joins me now, and we're talking about mental health. It is Mental Health Week, a conversation we should be having every day.
Absolutely. So Mel and I, we're going to stretch our legs here on this very important topic, but with a little help from our friends, we have a panel who've been kind enough to congregate here. Hello to Ramit Bilen, a PhD learning expert and an author. Also, Dr. Ariel Dalphin is joining us, psychiatrist at Mount Sinai, and Camille Quenville, CEO, Canadian Mental Health Association of Ontario. To all three of you, thank you for joining us this morning. This is an incredibly important topic, so let's dive right in. Dr. Dalphin, I want to start with you, and I want to start with the elderly. So much talk in this province about what this pandemic has done, whether it's long-term care or just people at home living by themselves who are older, who don't have people around them, who can't have people around them. What's your biggest concern for the elderly population of this province right now?
Well, I think we're all aware, as you mentioned, of the devastating effects on the elderly community and the intense social isolation, the intense fact that they've been cut off from a lot of their supports from the outside world, and, let alone all the physical damage that's been done in terms of deaths and in terms of very serious illness have all led to very significant concerns to both the bodies and, of course, the minds and emotional well-being of our seniors. So we're seeing high rates of mental health concerns, and we know that isolation and loneliness can really exacerbate existing conditions and can also create new signs of depression and anxiety and really concerning symptoms.
When we talk about symptoms, and I want to take now to the other side, to our younger population and to Ramit here, how do you know when you should step in? How do you know when it goes beyond just a bad day? You know, like
right.
Where are the signs? So Ramit, specifically for a lot of the kids who are currently in remote learning here, they've been struggling. So, and the students and the parents and the educators all around in this capacity. So, what are those signals, and how do you help?
Thank you so much for that question. And, even before pandemic, there were long wait lists for mental health services among youth. And what we've experienced over the last 419 days has really emphasized the need for support. And so some signs and symptoms that we want to be on the lookout for is the lower attention span, the difficulty in sleeping. We want to also be on the lookout for changes in appetite, whether that's increased or decreased. And when we think about these signs and symptoms, some of them are obvious and some of them are not so obvious. We also want to understand that just like us adults, youth are burnt out. They're experiencing that cost of the mental effort that's been involved in doing things in new ways, whether that's homework, going to school, online, in person, hybrid, or even connecting with their peers.
Camille, let me throw a hypothetical at you. Let's say someone watching this knows someone who they know is struggling, who they know needs some help. But maybe they're not going to be receptive to that. Maybe they're of the opinion, I'm fine, leave me alone, I'm fine. But you know that they need some help. How do you approach this person in a way where they become receptive to what you're trying to offer them?
Well, I think that's a great hypothetical, and it is true to life without question. So I think the first piece is to reach out and communicate with that person and be honest and sincere in your concern, and try to encourage them to have a conversation. And it's not surprising if somebody is initially reluctant, but stay at it. If you've noticed very significant changes in their behavior, if they're withdrawn, if they're not enjoying the things they used to do with you, then clearly there may be a sign that there's a broader issue. And really, putting it to them and asking them very concretely forces the issue. So I think having that engagement is important, and seeking help and assistance for them if necessary.
What about this? And I'll pose this one to Dr. Dalphin. How do you recognize these signs within yourself? And that's one that you have to be super introspective on. But how do you get there? How do you know?
Well, I think one of the first things to realize is any noticeable change from your normal personality, any noticeable change or sense that you're just not getting the same kind of joy out of life that you might have had before, that you're not laughing in the same way, that your personality may be a little bit different in terms of what's sparking you, what's sparking joy for you. And not having joy in life is one of the very prominent symptoms of depression. And sometimes people don't notice in themselves if they're not doing very well or if they're slipping. But that can be a very concrete way. And also, if you suspect anything, just as what Camille was saying, ask others to check in as well. Ask others, how do you think I'm doing? I'm just finding I'm a little bit off. So even if you don't feel you have the exact language, putting it out there, just like you guys are doing today, the how are you, and asking yourselves, how am I? How am I feeling these days? And if the answer is, I'm not getting that same sense of joy and that same sense of excitement, that could be one thing. The other things are looking at, how's your sleep? How's your appetite? How are you doing at work? Are you able to focus? Are you able to get things done? And a lot of the times with parents feeling like, is your fuse a lot shorter than it normally is? Are you noticing that you're getting frustrated or yelling more than you normally do? Getting feedback from our kids is often a very good way to find out how we're doing, because they will truth tell. They will tell us honestly how they think we are.
Ramit, let's stick with the kids angle here. And I know there are a lot of people in Ontario and some other provinces, frankly, who are concerned that remote learning might be here to stay more than we think. Really, also financially is the big reason, but the concern is that this is not going to be this September, everything back to normal situation. How concerned are you about that from a student standpoint?
From a student standpoint, it is that change in school, but it's also, in addition to that, the limitations in extracurricular activities, the limited access to things like sports, recreation, libraries, as well as connecting with their peers. So I am concerned because we have seen heightened anxiety among youth. And again, this was pre-pandemic, and it's just been emphasized a lot more over the last 14 months. So I am concerned, and I do hope that we put a lot more in the supports for them. And I'm so thankful for the supports that are available, and those who are on the other line when youth are texting, talk or connect to Kids Help Phone or visiting Wellness Together Canada.
Camille, for you, when you decide you're going to have a conversation, let's just say I want to reach out to Sid and ask him how he's doing. Do you have to be careful with your language or what you say to be able to open up that conversation? I know there are a lot of people who are, say, A-type personalities, and they're easy to cover up. They say, I'm fine, everything's okay. But are there words that you can use or specifics that you can say that maybe opens it up and makes them feel a bit more comfortable to say, actually, there is something going on?
I think any kind of honest communication where you are indicating to your friend or loved one that you've noticed a change in their behavior, that you're concerned about their mental health or well-being, very often is a good door opening to a broader conversation. And I think if it's delivered in a very sincere way, not a judgmental way, but rather in a way to suggest that you really want to help this person. And I think Dr. Delphin really gave excellent advice around that. We can judge our own behavior by the interaction we have with others. And I think when you say to someone that you've noticed that they have changed and that your relationship as a result has changed, then that maybe is a good precursor to there really being a problem and that person maybe feeling a little bit more comfortable wanting to go down that road with you.
And so much help is available. You can see all of the avenues there for you, the distress lines. Please write them down and go to the Breakfast Television website for more information. Dr. Delphin, how do you check in on elderly family or just neighbors of yours when there is an actual lockdown that we're currently in? Obviously, calling is the easiest thing, but and maybe they're not tech savvy, maybe they can't Zoom. Like what other suggestions are there in this moment to help that section of our society?
It's a great question. And I think we saw some really strong examples of what people were doing to stay connected to their elderly family, loved ones, friends, standing outside their doors or their windows and waving. And being really creative, holding up signs outside, especially for those in longer-term care homes where, as you mentioned earlier in the program, people have not been allowed access out, or for those who are in their own homes, dropping off little treats or something thoughtful, and anything. At this point in time, I think anything creative helps, whether it's waving at the window, dropping things off, knocking on the door, talking through the crack in the door, opening up the window, calling, FaceTiming, teaching people how to Zoom and use FaceTime and any other technology, really coming at it from any angle, just letting people know that you're thinking of them, letting people know that you care, and letting people know that you're really out there for them, because that can go a very long way to people who are isolated, lonely, and feeling quite down and depressed during this very, very hard time.
Dr. Dolphin, Ramit, and Camille, thank you for your expertise, your insight this morning. I think it was very helpful. And again, all of those numbers and resources that we put up on the site, on our screen, we'll put up on our site as well for anyone who is looking for that. Thank you so much.
Thank you.
Thank you.
Thank you.
We're going to take a quick break here on Breakfast Television. The conversation continues online. We're taking a quick break.